because we had discussed before how the concern from another newscast that I heard was that there'd be a lot of unnecessary mastectomies to come about from the women's side. What would be, in your mind, some of the unnecessary procedures that could come about because of hysteria as it relates to men? How might that manifest?
John, I'm glad you actually asked that question, because recently this week, I've actually had a patient that came into my office and actually had a preventative hysterectomy, had her ovaries taken out, had her uterus taken out, because she did have a strong family history, but had no genetic testing, had no risk factors looked at prior to having this. And last week, we even talked about some of the side effects of having a hysterectomy and taking all your hormones away. When you're 40 years old, you go from, it's like going from 60 to 0 in 10 seconds. And the effects that it has on a woman's body when you actually take away these type of things from women. And I think that the scare is out there, and people really need to know what this has effect on and get the testing done if you have the risk factors. And most importantly, last week I had told you that my mother is a breast cancer survivor from 10 years. She was diagnosed a month before had my 9-year-old. She went through treatment. She had both estrogen and progesterone sensitive, and she was on Premarin in the past. When we were kids, we also used to harass her, but she had a hysterectomy and her ovaries out at a young age. And I remember my life growing up with her and the symptoms and the misery that she was in having that, treatment done, and then got put on synthetic hormones. And my mother's actually on a testosterone pellet, and there's some research out there about testosterone and how it actually may be preventative. And those people that have actually had breast cancer, whether they are hormone sensitive or not, may have a benefit on them. And I don't want people to go out, and that's why I really want to bring this topic up, because this week it has been all over the media. We all know about how they pick up on a little clip, but we really wanted to go into detail today about how it can affect women and some of these unnecessary procedures and, like you mentioned, the hysteria out there that it can cause.